Wow, talk about a story that really got people fired up. This whole thing with the health insurance CEO, right?
Yeah, it's certainly been all over the news.
And, it's not just the story itself, it's what it says about health insurance in this country. That's why we're diving into this article today, folks. It uses this CEO's death as a jumping off point to talk about some really big, really important issues.
Well, and it does it in a pretty thought-provoking way. I mean, the author doesn't hold back.
No, they don't. Right away, they throw out this term, voluntary communism, to describe health insurance.
Yeah, I have to admit, I did a double take when I first read that. Voluntary communism. I mean, it sounds like an oxymoron, right?
It really does. So what is the author getting at here?
Well, they're trying to highlight the inherent tension in the system, you see. Because on one hand, you've got this idea of shared risk, pooled resources, this goal of covering as many people as possible.
Okay, yeah, I get that.
And on the surface, those concepts do have some similarities to, the theoretical ideals of communism.
But of course, the big difference is that nobody's being forced to buy health insurance.
Exactly. Hence the voluntary part. But even with that voluntary aspect, the author argues that there are some built-in problems with this model.
Like what?
Like the expectation that insurance should cover every single medical expense no matter what. The article claims that this is a big part of what drives up costs and creates inefficiencies.
Makes sense. If people aren't really feeling the cost of health care, they might be more likely to, I don't know, overuse it.
That's exactly it. It's actually a well-known concept in economics called moral hazard.
Oh, moral is that? Okay.
Basically, when you're insulated from the full financial consequence out of your choices, it can lead to, well, less responsible choices.
The article also makes this wild comparison between health insurance and gambling.
Yeah, that's one of the parts that really stuck with me, because when you break it down, there are some striking parallels.
So how does that work?
Think about it. Both insurance and gambling are built on this idea of pooling money. With gambling, the house, the casino, they always win in the long run because, the odds are in their favor.
Ah, I see. So with insurance.
It's similar. Companies collect premiums from a large group of people, knowing that, statistically, only a fraction of them will actually need major payouts.
So even when I'm feeling relieved that my insurance covered that expensive surgery, the reality is that overall, customers as a whole are losing money.
That's the somewhat paradoxical truth, but here's the thing. It kind of has to be that way for the system to work. I mean, if insurance companies paid out more than they took in, they would go bankrupt.
Yeah, they wouldn't be in business for very long.
Right. Then nobody would have coverage.
It's a tricky balance, for sure. And the article talks about this entitlement mentality that can make things even tougher. This idea that people feel like insurance should just cover everything, no questions asked.
It's understandable, though, right? Nobody wants to be saddled with crippling medical debt.
Of course not. But the article seems to be saying that we need to be more realistic about what insurance can and cannot do.
And that's where the gambling analogy really comes in handy, I think. Because we all understand that when you walk into a casino, you're not guaranteed to win.
Right, you go in knowing you might lose.
But with health insurance, there's sometimes this expectation that it should be different, that it should completely protect us from all financial risk.
To illustrate this point, the author contrasts health insurance with life insurance.
And it's a really smart comparison. With life insurance, the event that triggers a payout is crystal clear.
A person is either deceased or they're not.
Exactly. That black and white nature makes it much simpler. There's less room for interpretation.
Whereas with health, things get messy. What's considered medically necessary, what's experimental, there are all these gray areas that can lead to, disputes and frustration.
And that's a huge part of the problem, the article argues. It even gives some specific examples of these tricky situations where insurance companies are trying to, limit costs and patients are fighting for the treatment they believe they need.
And it sounds like the article doesn't just point the finger at insurance companies, right? It acknowledges that consumers play a role in this too.
It does, and I think that's important. It's easy to villainize insurance companies, and there are definitely cases where they act unethically, but...
But we also need to take a look in the mirror, so to speak.
Exactly. Are we demanding more from the system than it can realistically provide? Are our expectations contributing to the problem?
So what's the bottom line here? Is the author saying that the very idea of affordable, comprehensive health insurance is just a pipe dream?
In a way, yes. They're arguing that this belief that we can have unlimited benefits and low premiums, it just doesn't square with economic reality. You can't have it both
And
ways.
this brings us back to that CEO's death
Mm,
and the public's reaction. I mean, it was intense.
it was. And while that outrage is understandable, I think the article is pushing us to step back and ask, are we focusing on the right things? Are we so caught up in individual cases that we're missing the bigger picture?
Yeah, it's a good question. So where does this leave us? I guess one big takeaway is that health insurance is not as simple as we often think it is.
It's not just a safety net or, some kind of guaranteed right. It's a financial product, and it comes with its own rules, its own limitations.
And maybe by understanding those limitations, we can start having more honest and productive conversations about how to create a better system, one that's, more sustainable, more equitable.
Exactly. That's the hope, right?
And to leave you all with something to ponder, think about this. Knowing what we now know about the complexities of health insurance, the trade-offs involved, what kind of changes do we need to make? What could a more effective, more fair system look like?
That's a question worth wrestling with, for sure.
Absolutely.